Hello, I'm your host, Kathy Chester, and welcome to the Move It or Lose It podcast, a podcast about all things that move the mind, body, and soul. The Move It or Lose It podcast is for information, awareness, and inspirational purposes only. I am not a doctor, and I don't even play one on TV. So please consult with your doctor before making any medical decisions. The views expressed by advertisers, guests, or contributors are their opinions and not necessarily the views of the Move It or Lose It podcast. Hi guys, welcome to another edition of Move It or Lose It. And if you've ever listened to Move It or Lose It, you know my favorite psychologist, Meghan Beier, is with us today. And she has been with me for several different things when it comes to working with women, when we've done our Wind Down Wednesday. And she's done a lot of things to help us understand some of our issues with multiple sclerosis. And so with no further ado, Meghan, thank you so much for being with us again today.
I'm really excited to be here. Thank you for the invitation.
Absolutely. So Meghan, so many things have changed with you in the last few months. And I see it. I'll make a little comment on Twitter or on Find Empathy. It's something that you're doing. You've grown so much. You've changed a lot of things that are been happening. So share with us a little bit about some of the new things that have been going on with you.
Yeah, absolutely. So I think when we talked last, I had just started Find Empathy, which is both a continuing education platform for mental health providers to train them how to work with medical populations. But it's also a directory for finding a mental health provider that has this kind of specialty. So I just started that. We're still growing. I can talk more about that in a little bit, but I was still working pretty much full time at Johns Hopkins as a psychologist there. Since that time, I've actually reduced my time at Hopkins. I'm now there as just an adjunct faculty, and I'm continuing to grow Find Empathy, but I also joined a private practice called the Rowan Center for Behavioral Medicine. And one of the reasons I did that was because the Rowan Center started out in California. It's this really cool private practice that really focuses just on medical populations. And they had this vision of creating access to care for patients all over the country. And so they wanted to start growing. And so they brought me in to sort of help with that growth. So we just opened an office in Maryland, which I'm seeing patients at. And then we're also planting offices around the country in the coming years. That. So yeah, so keep up with either with me or you can look up the Rowan Center. But if you have a medical diagnosis and you're looking for a mental health provider, it's another avenue outside of kind of traditional academic medical centers.
That's great, because so many of us are, as you know, so many since COVID and before are trying to find that more than ever and are getting stuck. And I know we've talked a lot about that, you and I, and running a lot of the support groups. I'll often say that, you know, when they find a psychiatrist or psychologist and they don't click and they're like, they don't understand what I have. And I'm like, well, there's a whole nother slew of psychologists out there that do get what we have. So I always appreciate everything, that all the knowledge that you give to us, so that the ones that are running support groups and things like that can offer that to them, that there's so much more out there than than I was diagnosed a million years ago. It was like, you know, no one really understood. They're like, sweetie, it's okay. You'll be fine. And I'm just like, really? Do you know what's going on? So the Rowan Center, that's the plan, is to develop several throughout the country.
Yes, exactly. So this first year, we're looking at Colorado, Seattle, New York, and
Michigan.
We'll get there eventually. I think maybe Wisconsin. We talked to somebody recently out near there, but I definitely, the plan is to keep growing so that, you know, there's at least an office close by, or one per state, so that there can still be telemedicine options for everybody. But yeah, I mean, that I'm one of my goals throughout my entire career has been, how do we create more access for people? How do we find mental health in the community.
Mm,
And I think there's lots of awesome psychologists at different academic medical centers, and sometimes they're overrun with referrals, and sometimes, you maybe just can't get in to see them.
right.
Um, and so, one of the things also that I loved about the owner is that she also really believes strongly in not just having it be private pay, because not everybody can afford that, especially if you're living with a disability or chronic
Mm,
illness. And so the model is for us to be able to have access through insurance and Medicare and Medicaid and all of that too, so that people can have access in the community, which I think is hard when you're
yeah,
looking for somebody close by.
right.
Many psychologists and mental health providers, for lots of valid reasons, don't take insurance, but sometimes you need that.
Right. I think that's great. I think that's so tough, Megan, because, oftentimes we'll go see our neurologist and they'll say, it probably would be great if you could get someone to talk to, or there's several things that they'll tell us that aren't covered. Like
Yeah,
you would do really well with some massages, not covered.
not
And they'll
covered.
list like a million things that aren't covered. And as you just mentioned, when we do have an autoimmune disease or 3 or 4, then
Mhm.
the amount of money that goes out for us is so
Yes,
big. And it's like, we're just trying to make sure that we can pay our bills, let
exactly.
alone that it really isn't something that should be an extra, like a
Mhm.
massage or seeing a therapist. These are things that we need.
Yeah.
And so I really appreciate that at the Rowan Center, that's something that your boss is actually like thinks about and
Mhm.
understands that we don't have the money oftentimes that other families do, because a lot of times the person with an autoimmune disease isn't working.
Right.
And like in stages, I can think of myself and so many others that have applied or in the middle of it are not even on disability.
Yeah.
And the other partner is carrying all of the weight with small kids and things like that. And it
Mhm.
becomes such a huge thing for the family. And so having some help with that and doing a sliding scale or something where that person doesn't feel so overwhelmed and then not even able to get the help they need is such a big deal. So that sounds
Absolutely.
wonderful.
Yeah.
So
Yeah.
really able to then help with some of the issues. So I know that are dear to your heart, and I wrote some of them down, like for mental health stuff. So is this kind of, I would assume, just works along with your abilities and where you specialize in anger, anxiety, cognitive testing, depression, and grief. And I would
Mhm.
assume that that kind of works right along with those are the things that you specialize in.
Yes, yeah, absolutely. I mean, I still think I consider myself mostly a multiple sclerosis specialist because I've been working in MS for so long, and almost primarily in MS. But as the world has changed, right? Even when I was at Hopkins, saw a lot more COVID and long
Mhm.
COVID and people with MS who have long
Right,
COVID. And also, we know people with MS have lots of chronic pain. So
right.
there's some transition points there where there are other types of medical diagnoses that, that there's chronic pain. And so, yeah, so I would say grief, depression, anxiety, chronic pain, and other kind of autoimmune disorders or things that sort of come and go unexpectedly.
Right.
So all of that sort of uncertainty and unexpected, not knowing where your medical diagnosis is
Right.
going, those are all things that I work regularly
Yeah.
with people.
What have you seen, Megan, in the last, like since COVID? I know you've done a lot with COVID and multiple sclerosis. What have you seen with us in our community having MS? I mean, I know how I have dealt with COVID and loved ones and doing what I do with my MS clients. What have you seen with the fear and coming back into normal society, trying
Mhm.
to? How have you seen and what have been kind of the most difficult things to work through with patients?
Yeah, I would say that there's kind of a mixed response, but there's some healthy trepidation that many people, especially if they're on certain types of disease modifying medications that really can impact your immune system, right? There's trepidation going back into the world, right? And
Mhm.
especially when people are at this point less careful, not wearing masks, all of that kind of thing. And even this winter, not only COVID, but lots of different viruses are sort of
Sure.
rampant in the world. It can be really scary for people. And I think that's what I heard the most, is that people are worried about how this is going to affect their health. And I have had a few people who've gotten hospitalized. And so
Mhm.
there's some real concerns there. I think one of the things that we talked about was really focusing on values. And
Yeah.
so if you have, 5 choices of activities to do, right? Like you can go to visit your sister, you can go to a friend's birthday party, you can go to church, you can go to, I'll say this, my daughter and I went to a pet expo recently, right? Like a kind of at a convention center, which
Right.
was probably a bad idea because we got sick. But
Oh,
um,
no.
you have all these choices of activities you can do. I think what I typically do with my patients is I have us sort of go through those different options and look at your values, right? If I were to do that activity and get sick, would I regret going? Or is this so in line with my values? For example, having a close relationship with friends, or my spirituality, or having a good relationship with my family, that even if I got sick in that environment, it would have been worth it for me. It brought that much quality of life to me. Um, that's an activity to do.
Mm,
You can mitigate risk by not doing all the other things, right? Maybe not
right.
going to the grocery store and having groceries ordered in, or maybe not going to that party that you don't really want to go to but feel obligated to, right? You want to kind of pick the activities and mitigate your risk by not doing everything, but doing the
Mhm.
things that really bring, energy and vitality to your life.
Yeah, I think that's great advice. And I think struggling with that, do you find that females struggle with this more than males?
I think so.
Because I
Well,
know I do that
yes
a
and
lot.
no. I mean, I've had both males and females kind of worried about this. I tend to find that females like, it's a generalization, but tend to worry more about offending people.
Yeah, the whole people pleasing. Because I feel like,
Yes.
am I really still doing this at my age? But I'll sit with my husband and say, we were okay. We were invited to this, and this. Okay, this could be scary. This could be dangerous. And again, I'm on Ocrevus. So I feel like I'm going to be wearing that mask for another 10 years. But it's like, okay, I could do this. This could be too dangerous. This could have too many people. And you really do have to sit and analyze what things are bring you the most value, what
Mhm.
mean the most to you,
Yeah.
and what are you willing to do? And sometimes you look at the list and it's like, they were just going to stay home, watch a movie,
Mhm.
because all of them may just be too much for your body and your health at that time. And
Right.
sometimes, I mean, Megan, as you well know and hear, it really stinks. And it's
Yes.
like, dang it, I really wanted to go out and be with my friends. But
Mhm.
the choices, A, B, and C, were just too dangerous. And it does stink. But I think reaching out to a friend, that's where I always say, reach out to a friend who has what you have and
Yes.
say, didn't this stink? I had to give up 3 things I wanted to do.
Right.
And I find more than anything, they get it because
Yes.
it takes one to get it. So we understand what each other struggles with. And I know that I could talk to you and you referred me to Dr. Evan Smith, and I can complain to him. I wanted to do this and I couldn't, and he can put it in perspective for me and
Right.
say,
Right.
you went through your values. Good job. And you made a choice that fit for you and your family.
Exactly. And I know you mentioned the support group earlier, and to me, I think that that's one of the best things that people can do for their mental health as well, to have, if a support group isn't the right space for you, to find somebody else who at least understands the condition, because as much
Mhm.
as your family and friends want to be there and I think do their best, I think it's a whole nother layer of support when somebody says, yeah, I get having to give up that stuff. I get
Yeah.
having to, not only give up something because of my, reduced immune system, but fatigue, for example,
Right.
or, all that kind of stuff. So having somebody who really gets it can be
Yeah.
really helpful for that support.
Yeah. What do you think, Megan, too, about like a game plan for your return, when you're out and all of a sudden, I'll be out with my healthy friends, let's say, and they're like ready to go and they're still ready to, party or do something, whatever the next thing. And I'm like trying to stay with it, like me too. But inside I'm just like, so how do you tell your patients to have an exit strategy or a plan?
Yeah, I think it's kind of knowing your body as much as you can ahead of time. So one is sort of planning ahead of time, giving yourself extra rest for a day or two ahead of time, maybe taking a nap that morning, even if you don't feel like you need it, really to give yourself as much energy reserves as possible. So prepping ahead of time. And then it's sort of knowing your body. Even if you give yourself that extra prep time, how much can you realistically plan to be out without feeling like you're just dragging and it's not fun anymore? If that's 2 hours, then, you have to kind of cut it off at 2 hours and maybe say, I'll come for lunch, but I'm not going to do the movie afterwards, or, whatever it is, and have your own car or an Uber ready. And I think just kind of telling people ahead of time is really helpful too. Saying, I really want to come, but this thing that I have is unpredictable. And so I'm going to do the best I can to hang, but the likelihood is that I'm going to leave at this time. And that
Sure.
way there isn't this sort of surprise or, oh no, come on, you want to stay out. If you can sort of give those parameters ahead of time, it helps you to stick to them and also not overexert yourself. And it
Yeah.
also lets your friends know that you're not just bailing on them too.
Right.
And making lots of interpretations about, your behavior.
For sure. I like that.
Yeah.
So what have you found since COVID have you found people more apt to share with their care, or have you found people being more reclusive?
I think it's a little bit mixed. It depends on the person. Some people are much more private and they don't really want to share as many details. And so then they probably tend to be a little bit more reclusive or, not sharing as much. And also depends on the reactions they get, right? Because there are some people whose families and friends are really supportive and open and understanding. And then I've heard the complete opposite, right? Where there's certain friends or family that maybe are not as open or supportive or understanding. And so a lot of it depends on the individual's personality and the environment that they're in.
Yeah.
I think environment is such a huge factor.
For sure. Yeah. I'll hear a lot of things where the family will just say things like, this person is doing this with MS and they're doing great. So I don't know why you have to nap or rest. And I think, wow, that would be so toxic for that person to hear that all the time. And to think they have to then, match that person's activity level. And so, I always say gosh, I wish I would have gotten my degree for counseling, because I'm doing exercise stuff, but I'm counseling half the time. But there's so much, because it's this feeling of just feeling defeated when before they start, because they're already trying to compare themselves or being compared to someone else with the same disease, when you already know that someone, you could be getting your infusion and someone next to you is running marathons, and the person on the other side of you can't even walk, and they were diagnosed 2 weeks ago. And so because the disease is so crazy and called the snowflake disease, there is no way. But unfortunately, with our families and friends that don't have it, there really is no understanding unless they educate themselves. And it really has to be something that they choose to do.
Exactly. Yeah. I think that's the hard part, is that, it is the snowflake disease. It's so variable from person to person. And, I often tell people, you get to make the choice of whether you want to expend that energy trying to educate somebody about it, right? If it works for you to do that in the moment because you love and care about them and you want them to be a vital part of your life and you have the energy to do it in that moment, great. You can sort of share, well, it is different for each person, and here's some resources you can check out to, MS Society website or Can Do, or, whatever, fill in the blank. There's lots of resources out there.
Right.
Podcasts like yours, but you also get to say, you don't live in my body either, and
Exactly.
you don't have to respond to those questions. You can sort of put them to the side and say, no, this is just, I don't have the energy to explain this
Right.
today. Yeah.
Yeah. Now, so Megan, my second question with that, I guess, is how do you help out in a situation where you've got, a female or a male with MS and the family, husband, wife, mom, dad, whoever's there is just not getting it. And this person really needs that because they've got no one else to help them. Let's say
Mhm.
this person is in secondary MS and they really
Mhm.
need the help. So how do you help come alongside so this family understands, or you do your best to help them understand? What are
Yeah.
some tools or ways that you work with them? I'm thinking of my younger self and
Mm.
how someone would try to come along and have my family understand.
Yeah. I think sometimes it's sort of understanding your family member and what is the barrier. So it could be that this whole thing scares them and they don't want to think about it. They don't want to read about it. Or they, maybe it's just stubbornness, right? Where they think, oh, I know my neighbor's friend who has this. And so I think I know everything. Um, and so it's kind of understanding what the person's barriers are and then
Mhm.
then from there, how to work around it. So if it is really just sort of like the person is scared, because I've seen that a lot where I think family members are a little bit more fearful, and so then they put up these walls that feels very dismissive to their family member that's living with MS. And sometimes it's sort of breaking that down. Like, I know this might be scary for you. It's scary for me too. Um, but I really need you to understand this. And if and sometimes it's kind of figuring out what the line in the sand is for you.
Yeah,
Because, maybe it is, if you're not willing to listen to me or to believe me, or you're not willing to look at any of these resources, giving people a little bit of parameters because everybody's busy and everybody, whatever. But if that person's repeatedly not willing to listen, not willing
mhm,
to learn, not willing to put in any extra effort to be understanding, then it might be worth asking oneself if this is a person that I really want in my life regularly. Right.
sure,
I'm not, you don't necessarily have to completely oust them from your life, but it might
right,
be, I need to have a boundary around this person. I'm not going to talk about MS with this person because they're not a safe space for me. They're not
sure,
understanding, and I just feel worse when I talk to
yeah,
them about it. It's hard when that person is your only source of support.
yeah,
So I will say that that's a little bit more complicated, and
for sure,
kind of trying to figure all of those things out can take a lot of time and energy. But sometimes
absolutely,
leaning on nurses or social workers or psychologists or other kind of support groups to see if there's other sources of support that you can get a hold of
yeah.
can be helpful.
Yeah, I agree. I like that. And I think sometimes it can be so tricky because, in doing this support group with right now, it's just with women. And it is interesting to hear how they'll try to describe things and not having the support. And I wondered from a psychologist view, like how would you do that? How do you
Yeah.
help get the family to try. And I agree with you. Sometimes I know in my younger years, when it was time, I just had to say, you know what? I don't see how this person is going to be a healthy influence in this, back then. There still was like this idea, well, I'm just gonna work it out. I'll just run this out. But as the disease, obviously you realize it's not going anywhere. But as I journey with this, is this person actually going to be like a helpful person to me and my family and this disease, or is this
Mhm.
going to kind of be poisonous to me? So I
Yeah.
think it takes some time for you to kind of, as you're kind of more going through this, to figure out who is that helpful, who are those helpful people. And
Yeah.
so I think that that's really good, and also great to work through with you and with the importance of having a psychologist that does understand
Yeah.
what it is that we're working through. So
Yeah. I
what,
mean,
go ahead.
oh yeah, sorry. One more thought too. I mean, I think sometimes hearing it from an outside person too, like you said, with a psychologist, but you know, um, you and I have both worked with Can Do MS, and one of their big things is having support partners come to the events.
Yes.
And there's a separate support partner group and all of that. And, there was one event I was at where this spouse came out of the support partner group and he said, my wife has been living with MS for more than a decade. And I know she talks about fatigue, and I didn't really get it until today when I heard it from all of these other people, because I just thought she was tired. And now I'm really understanding that it's more than that. And he had been living with her for over a decade, right? So
Wow.
I think, sometimes you have to, if your support is willing, maybe trying to bring them to a support group or to your doctor's office or something where they can hear it, not just from you.
Yeah, that's so important. That's so key. And I think there's so many times where the support person doesn't know that they can get help or understand. And I think you're right in both ways. One, so that they can understand, and two, that they can get support. Because I don't think that they know that. And it's funny because I just did a podcast with Tyler Campbell and his spouse, and Julie Stam and her spouse, and just Chris Dunbar and his spouse, and just a couple of people that we could really just talk about, and that couple that has MS. And we just really talked about that. Like, what is it like when your spouse, the person you're with, has MS? And then, you're trying, and we really told some sad, but some funny stories that happen, and, things that are just, you don't plan on. And you just are, as a care person and the MS person, just some funny things. But ways also that, that you have to get through that and talk about things that are uncomfortable. But, we were really honest. And I think a lot of the MS ones we want our care person to have that love and that care too, and to get away from MS. And so one of the questions that I had asked them is, what are the things that you do to get out of MS? Those times where you just need to say, no MS talk, no, let's just have fun and get away from MS. And so I think that that's a big important thing for the care partner, but for you guys too, if your care person is, your significant other, that you find something not MS and just, do something fun, whether it might be a game, something that you do that is just no MS talk, because it so bombards your brain and everything. So
exactly. I was talking to somebody recently who is the parent of somebody who lives with an autoimmune disorder. And the parent said that because their life revolves so much about taking care of their child, her and her spouse have this agreement that every 2 weeks they'll go out to dinner and they won't talk about it. And every 2 months they'll have an overnight somewhere, just the two of them, and they won't talk about it. And every 2 years they go on a full week-long vacation and they won't talk about it.
I love
so they
it.
have this sort of, like set times where they get a break.
Yeah, that's so important, because it does, before you even, even as a mom and dad, that you're out, it's like you say no kid talk. And then 10 minutes, you're like, we're doing it. How did we get here? And so, it's so easy then to talk about your disease or whatever, work. And it's like, you really have to intentionally set that, or before you know it, you're there. And so I think I think a lot of times that happens, and tell me if I'm wrong, but I think that's how we kind of go into our own space when we're out with friends. Is there'll be a conversation, but we'll start thinking about something that hurts, something MS, and then we kind of exit the conversation because we're kind of in our head again. And so sometimes I think it's not just about, we kind of make ourselves sometimes isolated, is we just kind of go into our own head and go into our own thoughts, and we're not present.
Yeah. Yeah, I think that does happen. I think also, I see too, what adds to that is the cognitive challenges that many people feel too, right? If it feels like the conversation's moving too rapidly, and you tend to sort of sink away from it because it just feels hard to stay engaged too. So
Sure.
I definitely see that with the people that I've worked with.
Yeah. Yeah. And for sure. And I have felt that sometimes when I'm with a group and I'm in the conversation, and then it turns away and I'm like, I've lost it. I've now lost the conversation. I don't know where we are cognitively. And I kind of just think back because I'm like, I'll wait for something else to come up because I don't know where we are. So,
Yes.
or the worst is definitely after COVID is I'll be in mid-sentence and trying to converse. And I'm just like, I have no idea where I was going. And you realize if you have it and you're with a bunch of people who have it, they get you. But I've done it out with people that I don't really know well. And they just kind of look at me like, really? And I'm like, never mind, just be quiet. So it's such a strange thing, to have like where you're just completely, it's just gone. And it's not like, you have dementia or Alzheimer's, it's just gone. And you're like, don't know what happened. It might come back. It may not. So
Yes.
that can be tricky. And I think you kind of learn, either you learned how to joke around about it or you come up with some way to handle it. What are some ways that you help your clients your patients kind of deal with that?
Yeah, I mean, I think part of it is sort of getting used to being uncomfortable. So I have certain patients who are really good at laughing that away. And there are some people who don't feel comfortable laughing that away because it is, it's real, it's a real challenge. So I think sometimes it's, being okay with saying, okay, I lost my train of thought. You can keep the conversation going and I'll jump back in if I remember, or just give me a minute to think about it. And then if it's not coming back, okay, well, let's move on. It's not coming back. A lot of times though, I tell people like, take a deep breath in that moment, because I think there's a panic that happens when you're lost in the middle of a story and you can't remember what you were going to say. And so it's like, oh, what are they going to think about me? Or, all those automatic thoughts start popping
Right.
up. And so taking a deep breath, trying to kind of calm yourself down and not go into the panic mode can sometimes help you address it better, but also can help you cognitively too. So,
Yeah.
I'd say first take that deep breath, figure out whether
Start
you
with
just
that.
want the conversation to move on or, to ask for a pause. And I would say, most of the time people are understanding, and if people are not understanding, that tells you about them too,
Yeah.
and tells you what kind of relationship you want with those people.
Yeah. Yeah. And sometimes I think that takes a while, when you're really young, I think you get nerved up and it takes some time to feel that way, like, you know what? It's okay. I can let this
Mhm.
one go. So what are some of the things that you're most looking forward to? I know Find Empathy is changing a bit. So
Mhm.
what's coming up with that? Tell me a little bit about where you're going with that.
Yeah, so our first series was all in about multiple sclerosis.
I happen to really love that. I really
Oh,
enjoyed that very much.
I'm glad. I'm glad. Yeah, I was so pleased. I mean, it made me like it warmed my heart. I got lots of messages from people, and I would say mostly from people living with MS who
Mm,
said, even though it was sort of directed towards mental health
mm.
providers, who said, hey, this gave me kind of an insight into how mental health providers might think. And so
Yeah.
I was really glad that it sort of crossed across different populations and that people living with MS got something out of it.
Yeah.
So we did something with PsyPact. So PsyPact
Mm.
is this agreement between states that you can see people, psychologists across state lines. There's new states being added all the time.
Where are you at
Um,
with that, by the way? I didn't mean to interrupt. I just want
yeah,
how many states have it now?
I believe there's 38 states who have
Okay.
enacted
Okay.
legislation. And then there's a few, like, for example, New York that just
Mm,
passed the legislation but haven't enacted it. So
okay.
it will keep growing. I
Yeah.
think I would say the vast majority of the states will be part of it in the next couple of years. Um, so what that means is if you live in New York, you can see a psychologist in any of the states that are part of PsyPact. And so that helps you kind of expand and find more specialized
Absolutely.
providers too. I would say from there, we also have a new series that's going to be coming out soon. That was a collaboration with the Siegel Rare Neuro Autoimmune Association. I was very excited that they wanted to partner. And so we're focusing on autoimmune disorders that are neurologic. So things that a lot of people with MS are ruling out when they are first seeing their doctors. So or even experience like optic
Mm.
neuritis or transverse
Right.
myelitis, those
Mhm.
kinds of things.
Right.
Um, and then we also have a new series or coming out with spinal cord injury
Mhm.
and a few that are in the works. So women's health,
Mhm.
cancer, things like that. So later on in the year, we're going to have some other medical conditions, focusing kind of on the mental health aspects of those medical
Yeah.
conditions. Yeah.
That's awesome. Really exciting. I mean, it's just been I was so excited to meet you and to find empathy, because it really is, it's just such a great podcast. And it's just the information that I learned and the excitement of watching other psychologists wanting to learn more and wanting to get are they called the CUs? What is it called
Mhm.
that they get?
Yeah, continuing education, right?
Okay.
Mhm.
I really thought that was just such a great idea. And it excited us just to see that there were psychologists that wanted to learn more. And that was very exciting. And I'm so glad that you're continuing to do this. And it's just a really neat thing. So I know that when I talk about you and when I've got guests on, they're like, oh, I see her. I won't name any names, but
Yeah.
so you really made quite an impact on the MS community. And I hope that you know that. And I hope that you hear that often, because when I say your name, I always pretend like we're best friends. I'm just kidding. But I do,
Oh, we are.
yeah, we are in secret. But I really do appreciate you so much. I appreciate your help and everything you're doing for our community. And since I'm picking up autoimmune diseases like Pokemon cards, I tend to have so many now. So it just means a lot that you are researching and helping and really, not stopping, but really just doing so much for all of these crazy autoimmune diseases that are popping up, and mental health, because there are so many things that come up with that in the autoimmune diseases, but without, and I watch that, and it just means so much that there's so many of us working together to try to do so much to help since this. And I think, COVID brought a lot to light, of things that we had been, I think a lot of us have been working on, previous to that, like trying to
Mhm.
get it moving. And I think it just really kind of like pushed us forward fast, like, okay, this
Yeah.
has to happen now. And
Right.
so I love your heart. I love just your heart's desire to help others. And so I just love you being on, and I look forward to collaborating with you on some other things. And so good luck with this new role of yours. And I can't wait to hear
Thank
more.
you. Thank you so
Absolutely.
much. Thank you.
Yes.
I really appreciate all of your kind words, and it really means a lot. And I love continuing to watch all the work that others are doing in this community, and I feel very grateful to be part of it, and also, welcomed onto podcasts like yours, because, as much as I'm doing, I think you all are doing, you and others who are involved, people that you've named already, are doing so much good work for the MS community and beyond, right?
Mhm.
And I think that the biggest thing I hear is that people sometimes feel alone. And with
Yeah.
podcasts like yours and others,
Yeah.
it helps people feel less alone. And I think
Yeah.
that's the biggest important piece.
Agreed. Agreed. No isolation.
Yes, exactly.
Agreed. Well, thank you, Megan, so much. And I'll have how they can get a hold of you at the bottom of
Yes.
the show notes and where you are. And so go ahead and stay on, Megan, for a second. But thank you so much, guys, for listening again. Don't forget, you can find us on Apple, Spotify, wherever you listen to your podcast, and also on YouTube. So have a great day. Don't forget to make sure that you rate us, make sure that you subscribe. Have a great day, guys. Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us wherever you like your podcast, whether it's Apple, Spotify, Stitcher. Join us on that. And we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together. Have a great day.